Blythedale Children's Hospital in Valhalla is in the midst of a 2-year, $27 million construction project involving a number of renovations that has been moving forward without impacting the quality of care being received by patients. The effort has already added 8 beds to the traumatic brain injury unit, giving the hospital the only dedicated post-acute pediatric brain injury unit in New York State. The construction project also includes creating a new administrative suite, a new and expanded therapy village with its own rock climbing wall, a new pharmacy, an expanded and renovated parent education center and simulation lab, and an expanded assistive technology center. Blythedale CEO Larry Levine said that aside from a $2 million gift for expanding and modernizing the therapy village, funding is from the hospital's capital funds, and none had to be borrowed for the project. Blythedale's vice president in charge of operations is John Flanagan.
We have multiple layers of regulations that we have to ensure that we're meeting, both at the town level with Mount Pleasant, as well as for our regulatory accreditation with the Joint Commission, and also CMS, the Centers for Medicare and Medicaid Services, all have different sets of requirements that we must meet. And during the planning process, we work with our architects and our engineers to ensure we're meeting all of those requirements. We were supposed to start this project in February of 2020, and we were not able to do that because of COVID. So we had to pause the beginning of the project and work with our contractors, our construction team, and put together a careful safety plan first, which affected all of our timelines. And so we basically created a new plan.
Could you describe some of the extra safety measures you've had to take because of the pandemic?
Yeah, so because of the pandemic, we worked with our construction team to ensure that all of their staff would be safe, all of their contractors would be safe when they came on site. So the same screenings that we were doing for our hospital staff at our front entrance, we were doing for the construction staff as well. They took temperature checks. They did symptom screening. They had to wear masks everywhere in the construction site, in addition to washing their hands, keeping as distant as possible. So all of those safety protocols were put in place before we started. We started the project in July of 2020. We began with adding the beds for our traumatic brain injury unit. And we just finished that in late December. At the same time we were adding those 8 beds, we began the renovation of the administrative space, because this was the key that was going to allow us to do all the rest of the project. So that will be finished in March. Once we open that space and move all of the people who will be living there into that space, we'll be able to start the next 2 projects, which are the pharmacy and the simulation lab. And those will begin in April and go through about early 2022.